Emission and ejaculation are the culmination of the male sexual act. When the sexual stimulus becomes extremely intense, the reflex centers of the spinal cord begin to emit sympathetic impulses that leave the cord at the T12 to L2 and begin to emit sympathetic impulses that leave the spinal cord and pass to the genital organs through the hypogastric and pelvic sympathetic nerve plexuses to initiate emission, which is the forerunner of ejaculation. Emission begins with contraction of the vas deferens and the ampulla to cause expulsion of sperm into the internal urethra. Then contraction of the muscular coat of the prostate gland, followed by contraction of the seminal vesicles expel prostatic and seminal fluid also into the urethra, forcing the sperm forward. All these fluids mix in the internal urethra with mucus already secreted by the bulbourethral glands to form the semen. The process to this point is called emission. Now, the filling of the internal urethra with semen elicits sensory signals that are transmitted through the pudendal nerves to the sacral regions of the cord, giving the feeling of sudden fullness in the internal genital organs. Also, these sensory signals further excite rhythmical contraction of the internal genital organs and cause contraction of the ischiocavernosus and bulbocavernosus muscles that compress the bases of the penile erectile tissue. These effects together cause rhythmical and wave-like increases in pressure in both the erectile tissue of the penis and the genital ducts and urethra, which ejaculates the semen from the urethra to the exterior. This final process is called ejaculation. At the same time, the rhythmical contractions of the pelvic muscles and even of some of the muscles of the body trunk cause thrusting movements of the pelvis and penis, which also helps propel the semen into the deepest recesses of the vagina and perhaps even slightly into the cervix of the uterus. This entire period of emission and ejaculation is called the male orgasm.